Very good morning to all. I am Deepak Shukla, presently working as librarian grade 2 at BBDL Library, AIIMS, New Delhi. I am very thankful to AIIMS authorities and Dr. Shantanu Ganguly, our chief librarian, for giving me this opportunity to welcome you all to the first international webinar on use of digital technologies in shaping the future of medical libraries, empowering patients and engaging communities in healthcare settings, a case study. It is requested to all, please follow the do's and don'ts during the webinar. Join the session 15 minutes before the scheduled time. Make sure your microphone and camera are working properly. Participant can ask their queries in Q&A session only. Don'ts: mute your microphone when you are not speaking. Avoid noisy distractions during the presentation. Don't share your screen during the presentation. Today, we have eminent speakers with us, Professor Nelly Mahajan and Dr. Shantanu Ganguly. To set the ball rolling, our first speaker of the webinar is Professor Nelly Mahajan, College of DuPage Library, Webmaster, Merenjoy Rehab Hospital, USA. She is a prolific speaker and had years of experience in handling several important assignments related to health and hospital services sector. We have another eminent speaker is Dr. Shantanu Ganguly. Dr. Shantanu Ganguly is Chief Librarian of AIIMS Delhi. He is result-oriented professional having exceptional intellectual capabilities with over 28 years of experience in knowledge management, capability management, building project management, reporting and documentation, change management, resource management, and much more. And we have Mr. Prashant Srivastav. He is presently working as a librarian grade 1 in BBDL Library, AIIMS, New Delhi. He has professional experience of 16 years of medical librarianship. His work profile consists of library resource development and overall resource subscription of BBDL Library. During his career, he has performed in various important capacity for AIIMS Library. Today's webinar topic is very interesting area in healthcare sector. First time we are doing it. I am sure you will enjoy, and this will be going to a monthly affair. And do we have more international and national speakers to be talking on this area. Once again, thanks to all for joining us. Over to Mr. Prashant Srivastav.
Thank you, Deepak. Thank you very much. Hello, everyone. Good morning, good afternoon, good evening, as wherever you are. Myself, Prashant Srivastav, Library in Grade 1, BB Dikshit Library, AIIMS, New Delhi, India, welcomes you on Digital Health Connect 2021 webinar series hosted by BB Dikshit Library, AIIMS, New Delhi. Today's topic of webinar is use of digital technologies in shaping the future of medical libraries, empowering patients and engaging communities in healthcare setting, a case study. Now I am presenting a brief presentation related to today's theme. Digital Health Connect 2021 webinar series. Uh, uh, the topic of this webinar as digital technologies, how technologies are relevant for the medical libraries and how we can engage with the patient care and knowledge and health care professionals. Uh, this is the just a diagram where the patients are in the nucleus, healthcare communities are covering the patient element, and medical libraries are providing the support to various healthcare communities by the following tools: by the medical knowledge, discovery services, point of care tools. Now, how in this such type of the pandemic situation, how we can connect our services to the our healthcare communities and indirectly to the patients? There is the one way: digital health connect. Now, I want to inform you that relevant to today's topic, we have already set up a quiz. That is, the questions are of this quiz is that what may be the prominent roles of the library to play during the COVID-19 pandemic? What may be mode of the library is most suitable during pandemic time? What are video journals? The COVID-19 related infodemic is just as dangerous as the virus itself. Do you interested to discover new possibilities for digital libraries in pandemic time? Today, our speaker is renowned Professor Nelly Mahajan, Adjunct Professor at College of Debates Library in Alliance and a webmaster at the Marinjoy Rehabilitation Hospital, USA. She has an experience of 32 years to manage medical library. In 2017, she has awarded Winstead 12 Prize for Leadership, Innovation, Use of Advanced Technologies for Dissemination of Information. Today's session moderator is Dr. Shantanu Ganguly, Chief Librarian, BBDL Library, an expert of knowledge management, capacity building, and resource management for libraries. He has experience of 28 years in various capacities. Now, without taking much time, I am transferring control to session moderator Dr. Shantanu Ganguly. I request to Dr. Ganguly, please.
Thank you, Prashant. Thank you very much. Good morning to all. First of all, let me take this opportunity to thank Professor Nalini Mahajan, a very old friend of mine. I think I know her for the last 1 decade. She is one of the stalwart in the field of health and hospital services. And I think she is known to many of us who are present here right now. If you have attended any time the ICDL conference, I think she has attended almost all of them. So thank you, Nalini, for accepting our invitations on the behalf of All India Institute of Medical Sciences, New Delhi, and on my personal behalf. I thank you very much for joining us. I am also thankful to my esteemed director, Professor Randeep Guleria, for his consent and giving us this flagship to start this particular program, this monthly series of Digital Health Connect. I'm also thankful to Professor Sanjeev Lalwani, the registrar of All India Institute of Medical Sciences, who has given me a lot of initiatives on these areas. And I'm also thankful to our professor in charge, Professor S. Rajeshwari. She is my professor in charge, as well as she is the chairperson of the library committee also. And she has been supporting me from the day one when I was planning to, host such kind of a program. And also thankful to, Professor Sharif and other library committee members who have always given me a lot of strength in organizing such kind of an event and also spearheading this particular thing. I'm also thankful to Mr. Yogesh Kumar, who is in charge of this CMET, from where we are basically telecasting this entire event and all. And also thankful to, especially to Mr. Nikhil, who is basically behind the screen, but he is in the control of the entire this particular infrastructure which is taking place, and all the technocrats of the telemedicine department, through which we are broadcasting this, and even this particular recording of the entire event will also be available to all of you. Within the further taking the DO, let me give a very short presentation, because I don't want to come between you and Professor Nalini. When Professor Nalini is going to rock and roll the entire show, it's not my show, it's Professor Nalini's show. So let me just share my screen with all of you. A very short presentation for you, just to set the ball rolling. So can all of you see my screen?
Yes.
Yes, sir.
Okay,
yes.
fine. So welcome you once again to this Digital Health Connect, Health Knowledge Discovery Services. Myself, Dr. Shantanu Ganguly. I am the Chief Librarian of All India Institute of Medical Sciences. Just a couple of months back, I have taken over from my previous organization called TERI. I'm sure all of you know about this. Well, when I talk about All India Institute of Medical Sciences, in acronym is AIIMS, New Delhi, is a leading think tank organization in the country today. And BB Dixit Library is an integral division of this prestigious institution in the country, which serves the knowledge-based value-added services to different resident doctors and other stakeholders such as researchers, policymakers, and academicians. Recently, BB Dixit Library spearheaded two major initiatives, such as Research Information Management System and Health Knowledge Learning and Development Program. In fact, this particular webinar, this monthly webinar which we are doing, it is just a small, minuscule part of it only. One of the major objectives of this particular program is some of the pragmatic issues and challenges the libraries are facing in this current pandemic time. So we want to, rehearse on this particular area. We want to find out exactly how people are working on those areas. How hybrid learning environment are addressing the requirement of resident doctors for the clinical decision support system. How the core competency of the medical library professionals are changing or going to change with the growing demand of the digital transformation in the healthcare sector. Well, there is a very important component I want to emphasize here, which is on knowledge discovery and data mining. When in short form, in an acronym, we call it as KDD, is the non-trivial process of extracting the implicit, novel, and useful information from the large volume of data. Enormous amount of data is rising today. And when I talk about data, it is not only the numerical data, but even is the textual data which I am talking about. A multidisciplinary field of science and technology. KDD includes statistics, database systems, computer programming, machine learning, and artificial intelligence. It spans a wide range of applications in medicine and population health. Like, for example, the study of the drug implications, the disease outbreak, and the environmental science like food predictions and all. So these are some of the very, very vital areas. In fact, we are ourselves in All India Institute of Medical Sciences in BB Dixit Library is taking a plunge into these KDD areas. Some of the major applications which we are looking at in a much more holistic view or a broad scale is clinical medicine. Modern hospitals and clinical centers surpass their traditional role as a place for disease diagnosis and treatment, and now acting as a master database and a source of complex clinical, laboratory, equipment use, and drug management data, which can be analyzed for disease diagnosis and the decision-making process. Well, public health, including the early outbreak detections, healthcare, and syndromic surveillance. So these are some of the extremely important areas we need to look at. Another area is healthcare text mining, including mining the medical literature as well as mining clinical data such as patient and clinical record systems. Here, I would like to mention that when I was organizing this international conference, ICDL, in 2019, I think, one of the researchers came from IBM who actually, showcase a very interesting example or a case study where the healthcare text mining, how it is playing a pragmatic role and getting very deep into the different literature, because we are all submerged in the literature. But it is going very deep into it and finding out the right and the relevant information for my researchers. The kind of technologies which are on the back end, which is working. The kind of clinical, the taxonomy architecture was created, or the ontology platform is created, or the kind of different kinds of AI applications has been taken into considerations for doing the deep learning research in the field of text mining. Another area is your healthcare policy and planning, while including the detecting expensive clinical profiles among patients diagnosed with a specific chronic illness, which has a high disease burden such as diabetes and all. And there are an enormous amount of data which is helping in the healthcare policy and the planning purpose, because without backing of the entire data, these things cannot be possible. So it needs a lot of major applications are coming up, and this is the need of the hour for right now. One of the important areas, since I have a long years of experience in the field of knowledge management, So this is a new area where I started venturing out. So I thought, why not to share with all of you, which is on a knowledge management in healthcare sector. Solving the problems and making optimal decisions in healthcare is heavily dependent on access to knowledge. Now, please remember this particular word, access to knowledge, is the thing for all the professionals who have logged in today. And this is the important word today. And this is the need of the hour today. It is rapidly becoming essential for healthcare organizations to effectively manage both internal knowledge and external generated knowledge in order to provide the best possible healthcare, achieve operational excellence, and foster the innovation. So that's a very, very important area where we need to look at the knowledge management. Probably in my coming, other webinars, we are going to have a more, strategic discussions on this particular area on knowledge management in healthcare. A well-organized and effective strategy for knowledge management in healthcare can help organizations achieve these goals. So this is one of the areas where we have started working, and I'm sure in coming months we would be able to do some kind of deliberations and discussions and debates will take place on this area of knowledge management in healthcare. Now, when I talk about this particular program, or this kind of this health knowledge learning and development program, which I am focusing here right now, see, one of the important component, the rational outcome is that there is a high time for us to revive the medical librarianship in this country. We need to create a network of medical library professionals across the globe working in different areas of healthcare support and services. In fact, when I started thinking about conceptualizing this particular thing, I got connected with many of the medical library and health library professionals across the globe. And they have accepted my request to come and discuss with all of us. And in coming months, I am going to bring them in from different countries to see how the medical librarianship are working on those areas. To understand and provide a relevant knowledge services to clinicians, this is the most fundamental area. We are serving to the different stakeholders. We are serving to the different types of resident doctors, to the clinicians. But what is the right information at the right time for the right resident doctor is the challenge. How do we address this challenge? And I'm sure Professor Nalini is going to, showcase some of her in our case study, that how she has been doing it in her own time to bridge the digital gap between the have and the have-nots. It's not that under the sun I may be having everything, but there are certain things which we need to look at, which are very important in today's context. To exchange and learn from each other's best practices, the skills and the expertise, and to bring in the innovations in medical information knowledge services, and to understand new areas of research-based knowledge and data services. So it is not only, we are organizing this event, but even it is for me and for my entire team who are here. For us also, it is a learning outcome. It is nothing but a rational outcome for us. It is also a learning process for all of us. It is not that we are going to deliberating. We are exchanging knowledge among others with all of us, all of you who are there. So most important thing in the long term, we would request you, so connect, collaborate, and communicate with us. So thank you all for setting the ball rolling. And now my next thing is that I'll stop presenting here. I think all of you must be very anxious to hear Professor Nelly Mahajan, who is going to do the entire sessions here. So without taking a more due, I would request Professor Nalini Mahajan to start. But before that, I would request Prashant. Prashant, can you please read out our resume if you have with you? So please, can you read out your resume?
Yes, sir.
Yeah, please carry on. I would request each one of you to please unmute yourself, except the speaker. Rest of the people should not mute themselves. Otherwise, it is very disturbing, and I would be bound to take you out from the discussion. Please accept my accepting for me to be little rude on this, because I find that there is a please don't unmute yourself. Please keep yourself onto mute section. Prashant, please carry on.
Yes, sir. Dr. Nelly Mahajan is an adjunct professor at College of DPS Library in Alliance and a webmaster at the Marinjoy Rehabilitation Hospital, where she managed the medical library for 32 years. Dr. Nelly Mahajan is an adjunct professor, and she developed and maintained several websites, including information connection and disability and rehabilitation. She has been a speaker at several national and international meetings and presented papers, published articles, and taught continuing education courses at MLA, SLA, and has her own consulting services. She has held many leadership positions at both SLA and MLA, including the chair of the executive board of SLA, Biomedical and Life Sciences Division, for 2017 and 2015. In addition, she is on Library Board of Advisors for Duties Review Service. Dr. Nalini has been a leader in developing, applying emerging technologies for providing timely access to his quality critical important information to help clinicians and consumers make informed healthcare decisions and improve patients' outcomes. Among her various recognition in 2017, Dr. Nalini received the Winfred Swell Prize for leadership, innovation, and use of advanced technologies for dissemination of information. She is also a recipient of DBIO Distinguished Member of Award in 2016, Lion of the Year Award from Alliance Library System in 2010, COD Outstanding Part-Time Faculty Award in 1996, and Scroll and Exemplary Service for the Hospital Service Section for MLA in 2015 and 2002. Now it's over to Dr. Ganguly, please.
Yeah, I think Nalini, now the ball is all yours, so you can start to do the rock and roll. Please. Thank you, Nalini. Once again.
Thank you so much, Prashant. This was an amazing introduction. Thank you all for joining this webinar. I know the time is very important to all of you, so I truly appreciate it. Namaskar, namaste, good morning, good evening, wherever you are. I'm in Chicago, so it's 10:23 right now here. Thank you. What a wonderful opportunity to speak to such a diverse audience and share my experiences with the experts from all over the world. Thank you very much, Shantanu, for your invitation. I am humbled, honored, and excited to be here. My special thanks to all the team, your library team, who has been working diligently and spent hours behind the scenes to make this work. And last but not the least, my thanks to the audience for their valuable time. Without them, we would not be here. So thank you again. And before I begin, I would like to have a brief silence for the pain and suffering caused by COVID that we have seen as a community, as a nation, and as a world in so many ways. So I would appreciate just a second of silence. Thank you. So, Prashant, should I put my share my screen now?
Yes, please, Nalini,
Yes,
carry
yes.
on.
Yes, ma'am.
So the PowerPoint.
Yes, ma'am. PowerPoint.
Yeah.
Right?
Yes,
We
yes.
can see now. We can see now.
Now you can see.
Yep.
I just wanted to give a brief background about myself. I know you have said a lot, but I do come from India. I was born there, and I still consider that as my home. So it's always fun to be back in India with all of you people. I come from Dharamshala, which is a small place in Himachal Pradesh. It's actually on the foothills of the Himalayan mountains, and it's just gorgeous. So I miss my home. I miss Delhi because that's where I grew up and spent a lot of time, Delhi and Bombay. And I think it's so nice to have the East and West combination living here so that you can appreciate both the values. So just wanted to say that it's so nice whenever I come to meet you all and have wonderful time with you. So now I'm going to talk about, basically, I discussed it with Shantanu, and first we were going to talk about the professional competencies, and then he suggested that I talk about the consumerism. I call it consumerism, and that is the hottest trend right now. But basically, empowering patients and engaging communities in healthcare setting, and how do librarians play an important part doing that. We are going to talk about the trends in digital technologies and the trends in the libraries very shortly, touch upon those. And then I will talk a little bit also before that, the professional competencies, but I'm not going to touch upon each one of them. I did discuss it with Shantanu, and maybe in future sometime I can come back and talk about those professional competencies. Because what we did at Mary and Joy, where I worked as the director of the library, we applied all those competencies, and the outcome was amazing. So I want to bring that knowledge to all of you people. I'm sure you all do it in your day-to-day life, but it is very, very important to go deeply into those competencies. And if you can make practical use of those, you will be amazed at the outcomes. So today, as I mentioned, I will briefly mention that, but then we will go deeper into the case study. I started at Mary and Joy in 1986. Before that, I worked in an academic library, which is Patty Library in State College at Penn State University. And in 1986, I joined Mary and Joy. And at that time, things were very, very different. We have accreditation agency. It's called Joint Commission. And that actually credits the hospitals. And it's a very big accreditation process for the hospitals. And hospitals always want to be credited by Joint Commission. So I was actually hired at the library because the accreditation agency was coming. We were just starting a residency program there. And for the residency program, you had to have a library. Otherwise, I don't think, to be very honest, the hospital would have hired a professional librarian. So when I went there, they had already established a library. The librarian had been there only for about 5 months, and she left. Mary and Joy is a freestanding rehab hospital, and it's run by Franciscan sisters. So it has very deep roots in Catholic religion. I was told to run the library which was actually managed by nuns there. We had nuns on the premises. And the library, whenever nuns wanted to, they could open it. Whenever they wanted it closed, when there was mass, they will close it. And also, there were actually no journals in the library. They were books that had been donated by some from different doctors, but mostly fiction. And I still remember there was one book which had 11 copies of it, and it was a psychology text. So that's how I started the library. So whenever we do another session, I will tell you how we used the professional competencies to bring that library to one of the top libraries not only in the United States, but in the world, for physical medicine and rehabilitation. So let me start today's presentation. According to the SLA, President Tom Rinks in 2016, there is virtually no area of work today that does not use information and data. And people who are skilled in finding, analyzing, managing, organizing, and sharing information and data can make the critical difference between organizational success and failure. And that's what I was talking about. That is what the librarians can do to an organization. So MLA, the Medical Library Association, actually, according to, I'm sorry, can you hear me?
Yes.
Oh, sorry. So according to MLA, health sciences librarianship stands apart in ensuring that knowledge about advances in the science and technology of healthcare research and practice is readily accessible to healthcare professionals, educators, students, researchers, and the public. That's the main goal of a librarian at a hospital or anywhere. Now, SLA, according to them, professional competencies relate to the special library's knowledge in the areas of information resources, information access, technology, management and research, and the ability to use these areas of knowledge as a basis of providing library and information services. And Shantanu, always talks about knowledge management and the technology and how we can improve upon it. So I don't know the professional competencies. I should have checked that. I don't know if you have some medical competencies which in India, they require you to, not require, but give you some guidance. But here, MLA and SLA both are very, very helpful to us. And of course, they are helpful to you too, because these are international organizations. So the Medical Library Association defines professional competencies as essential professional skills and abilities that can be observed, measured, and taught. So those are the professional competencies which are essential for the professional librarians. Now, I didn't go into details and discuss the SLA competencies. I am talking to mostly medical librarians, so I decided to limit it. I'm sorry? Hello?
Please continue, ma'am.
Oh, okay. So there was a task force, and that identified 6 competencies necessary for professional success. And these actually serve as a foundation. So competency 1 is information services. Competency 2, information management. Competency 3, instruction and instructional design. 4, leadership and management. 5, evidence-based practice and research. And I am sure that evidence-based practice and research besides the above four, probably are very important in these days. We are doing a lot of work in evidence-based practice and research. And I am going to focus on competency 6, which is health information professionalism. And according to MLA, a health information professional promotes the development of the health information professions and collaborates with other professionals to improve healthcare and access to healthcare information. So we are looking at librarians to collaborate with professionals of other fields who are responsible for the healthcare. And by doing so, we provide access to the healthcare information, and the outcomes would change. As a member of a profession, we are motivated to contribute to society in ways that highlight our special knowledge and expertise. So what are the latest trends? I am sure that, just like in the United States, everywhere, the healthcare is going through tremendous changes. We are looking at technologically advancements and transforming the entire healthcare industry. And COVID, of course, has changed a lot. Later on, we will talk about it. But COVID, actually, the latest technology trends are a lot based on what happened during the last 1 year. What were the changes? And you will just see that. So one trend that I wanted to talk to and especially share with you that there has been a 30% decrease over the last years in the number of the medical libraries, unfortunately, in USA. The Library and Book Trade Almanac listed that in 2000 edition, there were 2,055 US medical libraries and 1,384 in 2017. So you can see the difference. And DocLine, I don't know how many of you are familiar with this. It is a document delivery service which is run by the National Library of Medicine. And you actually become a member of DocLine. It's a service which is free, and several members join this, and they become members. But then each member can set their own rules and regulations. So sometimes if you are outside a consortium or outside a library which provides free interlibrary loan, you would have to pay. So all these membership, actually the medical libraries, most of them, I would say, have the membership in DocLine. So they also showed a similar decrease. 3,166 libraries were registered in 2007. And now we have 2,140, and that is a number from 2017. So it's a very sad situation to see. What's happening is that different medical systems are being merged. And once they merge, not every single hospital has a library. There can be one library going to 3 different hospitals. Or if it's within a system, then I can work for 3 libraries from one library. And it happened actually recently. The place where I worked, Marian Joy Rehabilitation Hospital, that was actually a big, huge network. Northwestern Medicine bought our hospital because the nuns had decided to sell all their assets. And everything has changed since then. I just retired from there 3 years ago. I still do I'm still the webmaster, but that is also changing, and we are planning to go back and start working on that again. But unfortunately, the 3 hospitals that we are very close by, 2 of them I left They did not hire a professional librarian after me. They do have someone I trained. I just talked to her actually 2 days ago, just wanted to find out how things were going with COVID. And she told me, naturally, there is, I'm not there. And she does not, or they do, I shouldn't say she, because there is a manager there too. I don't think they spend the time to market the library or promote the library the way we used to do. At least that's what she told me. She said, I miss those days because it's completely changed. They do have the electrical resources, databases, and most of the things the way we had it, but it's completely changed. So that's what is happening. So now we are going to talk about the health technology trends in 2020 and beyond. And most of these you are familiar with. mHealth, which is the mobile technology that puts healthcare in palm of your hands, that is being used a lot. And I am sure in India, the residents and the physicians do the same. Here, all these doctors, they do use all the databases from their mobile phones. And we actually provide, not the mobile phones, that those are provided by the hospital, but we put all those, at least when I was there, we used to download all those databases for them. Then virtual care management, you are aware of that. That is actually becoming more and more popular. And there are more demands for that because the consumers, the doctors, all the healthcare workers are looking towards that. Telemedicine, actually, Shantanu mentioned several times. Informatics, artificial intelligence has taken a whole different role. Augmented reality and patient-centered care. That is the main thing, patient-centered care. Everything that you do, whether it's telemedicine, it's virtual care management, whatever you do, it's centered around the patient. So patient is the king. You do everything. Patient satisfaction is very, very important. And then big data and electronic health records. Actually, Shantanu talked about it. And that is going to a whole different level. I was actually in emergency yesterday. And it's amazing to see, I went in there. They did not ask me if I had any insurance, because all my records, the minute from the ambulance, the technician called and they told them that, the patient is arriving, they were able to go into my records, even though it was not my hospital. But they were able to access, because of the EHR, they were able to access, get hold of my insurance, get hold of all my records. So when I arrived there and the doctor came to see me, she already had access to all my records. She knew that in the past 1 month, unfortunately, I had been to the emergency 3 times, and she looked at all the records. So they knew what had been done and what needed to be done. I didn't have to fill out any forms because all the information was right there. And then, of course, internet and social media, and I'm going to talk about it a lot when it comes to the consumer. The tech backlash. Now, you have heard about it. We do know there is a lot of tech backlash, but that doesn't mean that technology, I'm talking about the big tech companies like Facebook, like Twitter, they're not going to go anywhere. And actually, I was reading an article 2 days ago that the numbers are, going up and up. So there is backlash because of the political situation, because of the other things, but it's not going to go away. Workforce diversity and safety. That's a very, very important thing. I don't know how much you do about diversity in India. Here in the hospitals, it has become a very big thing because we have patients from all different ethnicities, religions, and when a patient arrives in a hospital, you have to respect them. You have to respect their customs, their religion. And I actually worked on, I'm just going to get a drink of water. Sorry about that. So I was a chairperson of the diversity committee for 4 years. And we did a tremendous job. We were given all, it was done on a scientific basis. So we were given all the census, how many religions, how many ethnicities were there. Based on that, we would actually base our goals and objectives. The first year, we were able to come up with a meditation room. Anybody could go there and pray or meditate. We also provided Quran for Muslims, Gita for Hindus, and of course, Bible. And then we added other ethnicities to it. I was responsible on the website. I took an initiative, and we had a huge section on diversity. So what used to happen is that we would actually, the patient, when they were admitted from the website, they could download the information about that ethnicity. So if a Muslim was admitted, they had, the way I had done it, there was a cheat sheet for a quick reference, and then there was one in details. So they could download the quick cheat sheet, and they could go over that very quickly and find out that the Muslims, for example, did not like to be treated by an opposite sex. So they preferred to have, a male would prefer to have a male, and a female would prefer to have a female. Then about their diet, they also knew that they cannot, Muslims, like to cover the entire body. So we made very sure that their body was covered, and the nurses, when they went to the room, if it was a male nurse, they would always ask them. So these were the things that we did for the different religions and ethnicities. And then we also brought in special menus for them to choose from for their diet. So you can see this is all actually based on the needs of the patient. And that's why we keep coming back to the patient-centered care and consumerism. Consumerism is a very, very hot trend. And the next one is the digital health trends in 2021. I don't know if you know much about the rise of smart hospitals. We are getting to that point, and there are some hospitals which are called smart hospitals, but it's hard to define them at this point, and not many of them are actually there. But the smart hospitals, what they do is, because patients no longer appreciate the conventional hospital experience, they want a smart hospital offered by the infusion of healthcare and IoT. What they do is basically, they are like smart homes or smart cars. And a smart hospital doesn't stop at being digital. It goes a step beyond that to generating value through data and insights. The infrastructure foundation of smart hospital stands on 3 pillars. And I'm reading that from an article. It's data, insights, and access. This means that smart hospitals would have digital system feeding data constantly into data science, machine learning, or data analytics, software to drive insights. And then these insights will be available via a smart device to all physicians, practitioners, nurses, IT department, and other stakeholders. So they don't have to go anywhere else. It's one center place from where they can all access the data, the insights, and everything. So that is what Smart Hospital is called. And we do have a few. A digital front door to improve experience. And this is also based on consumerism. The reason is with COVID, we were doing so many virtual appointments. We could not go to the hospitals. We could not go to the clinics. So we would basically have a virtual appointment with the doctor. So whenever I needed to talk to a doctor, it would be on a phone or a video. And it was just like, meeting a doctor in person. And because of that, there are so many changes now that it has, the virtual reality now has emerged as a very, very powerful healthcare tool. It also helped in reducing the clinical burden. And then, of course, evolution of Internet of Medical Things. Then the complex and chronic disease care now move outside four walls, and which is very much like virtual, because what happens is, for example, pain patients, now they can actually do all their exercises from home with their physical therapists. That's just one example. And then again, this list, which came from Digital Health Trends in 2021, listed consumerism as, again, a very big, powerful thing. So this is what I wanted to talk about, the professional competencies and what the latest trends are. And I'm just going to show you very quickly a few slides. And the first one is, Shantanu, how much time do I have? Hello?
Another 15 minutes, Nalini.
Oh, okay. So, this shows you the comparison. The last decade, where we used the stethoscope and the equipment. This is the medical platforms. And here we see the wearable big data, health analytics, etc. And then now we are using robotics, we are using artificial intelligence, and we are using the augmented reality. And this is the old way of taking notes, and this is the new way of taking notes. And we are doing the audio-enabled multi-devices. They are all synced in, so they can access everything from one device. And here, of course, in the libraries, we have books, and now we have books. They can be Apple, Amazon, Kindle, all tons of different things. And then this is making appointments, which I just talked about, and now you can do it via your smartphone, and also internet and Facebook and Twitter. All these social media are playing a very big part into that. So this is what I'm going to talk about now, the next 15 minutes. Consumerism, the hottest trend. This is actually from one of the papers I published. It is very clear the future of healthcare will be greatly shaped by the rise of consumerism. Consumerism has become the new normal. Many social media tools are available for healthcare professionals and patients. These tools can be used to improve and enhance professional networking and patient care. Consumerism advocates patients' involvement in making their own healthcare decisions. And consumers want to take a lead role and have an active partnership with the physicians. This is just tells you that this is from Accenture, the Accenture company, and this they publish that trust in the hospitals and doctors to keep digital healthcare information actually, if you look at the first and second row, this is all related to health. And they have, the consumers have a lot of trust in the healthcare arena. But when it goes to the different, the government companies, the tech companies, and the non-medical staff, they do not have much trust in them. And then here, again, Accenture tells us that even though there are fewer consumers using digital tools to manage their health, which would be the wearable technology. So the wearable technology is like Fitbits and other things that you wear for keeping track of your health. That is down. But the mobile phone and the tablet tablet applications are on the rise. So COVID-19 actually forced a surge in all this. And consumers want a variety of virtual health services. So they would like to choose the virtual for health and wellness advisors, and they are open to remote monitoring of ongoing health issues through at-home devices. So virtual care from new and traditional providers. Now we come to access to information. Actually, consumers have access to the World Wide Web, and it has dramatically increased the ease of access to health information. It has evolved from static web publishing to the high participative and data-driven platform. Innovations of Web 2 has been influencing how people search for health-related information. And of course, social media is a big player. I'm not going to go to the internet and social media. You can look at these, but it just tells you that here that 55% of the world's population has internet access. And this is the use per minute on the internet in 2020. So they were 400,000 approximately hours of video streamed by users every minute, Netflix. There were 2,704 app installations. There were 500 hours of videos uploaded by users. And if you look at all this, it's amazing, the data when you look at per minute. And this is from Statista. And then, of course, there is the global digital population. And as of January 2021, this is in billions. So it tells you how many active, internet users were there, and the active mobile access, and then social media, and then the mobile social. And which types of health apps and smart devices connected to the internet have you used in the past? So this gives you a breakdown of that. You are welcome to look at these. So what we saw was that the survey from Accenture showed that before COVID, growth in digital health adoption had stalled, but COVID accelerated the adoption of virtual health. But we don't know if it's going to really stay on. It's our job that consumers find reliable tools to so that they can use and they have still trust in the virtual, digital health. So there are several factors that could drive or stall post-pandemic progress. So we have to be very, very careful as to what we do. And then, let's see here. So access to information, what does it do? The seekers go online to become informed, prepare for their appointments, surgery, and much more. They share information and they seek and provide support. Now there are many, many platforms that provide patients, caregivers, and healthcare staff to share stories. So what we did it, and that's what I'm going to talk about a little bit, that what we did, this was one of those platforms. Because now patients are actually even self-organizing online communities where caregivers, clinicians, researchers, academicians, and industry all are focused on a particular disease. And once you go there, you actually can get answers from the healthcare workers, from a physician, for a nurse, and most of them do not charge anything. So these are the physicians who are actually employed by very famous universities and hospitals, and they spend time answering those questions. And then, of course, you find loosely bound communities who are operating via a variety of digital platforms. So the challenges we have, even though the availability of medical information empowers people, patients, families, consumers, there are lots of challenges. It's difficult, first of all, for them to navigate because not every platform is tailored to the user's needs. Quality of information varies greatly. There are very few tools available to evaluate the quality and credibility. Regardless of possible benefits, the patient-doctor relationship that we talk about so much, and the patients would like to have a very trusting relationship with their physician. Unfortunately, when the patient goes for his or her appointment, it's not easy to talk to the patient and to the doctor. And the physicians do not encourage if they talk about any information from the internet. So it's very, very difficult even now to have that trust with your physician where you can talk about information gathered from internet. And then, of course, there is ambiguous, conflicting, or inadequate online information. And that increases uncertainty and distress during the internet searches because you're doing the searches, and what happens is you come across 100, 300 hits, and you really don't know which place to go to. But as librarians, we guide them. As librarians, we can take over these platforms or help them. When I say take over, not take over the platform in reality, but take over that responsibility because we do have those skills. Those skills mean a lot. And that is how you make these platforms reliable and something that can be easily navigated. And then you can provide continuous training on these platforms. I just wanted to mention one term here, which is called cyberchondrias. So this is excessive and repeated online health-related searches associated with an increase in health anxiety. So what happens is there are studies that have shown that people who are worried or anxious about their health information, they keep going on the internet to do the same search over and over and over again. And then that causes health anxiety, and then they will go back. So now they are actually looking at it very, very seriously. So patient, as we found out, is at the center of the care. So this we talked about. But as I mentioned, hospital librarian can play an important role by leveraging the social media to minimize misinformation, create a community of followers, and influence online conversations. This is very, very important. And this is in one of my papers where it was role of medical librarian in building digital communities, which I presented a long time ago. So this is Marion Joy Rehabilitation Hospital. It's located in Wheaton. It was at the time 120 bed when we did the study, and it is a flagship facility. And it is a freestanding Physical Medicine and Rehabilitation Hospital. It deals with brain injury, spinal cord injury, stroke, neuromuscular, orthopedic, musculoskeletal, pain management, and pediatric. So I'm going to talk about this project briefly, that how even at a very, very small hospital library like ours, we actually expanded the role of the library beyond the traditional walls. Shantanu mentioned making information accessible. And I have one mantra, which I have always, always followed, and that is provide our access to information when and where needed, at the time of care and at the time of need. That was my mantra from the first day, and that's what I believed in. So we used several actually processes and several techniques to provide that information, because as a librarian, and actually searching is my passion. I had to get a training. It was a 3-week training by National Library. They have stopped now, but this I'm talking about 1986. I actually attended a 3-week, stayed in a hotel. National Library of Medicine trainers came, and they taught us how to use the trees. I don't know if any one of you, maybe I'm, telling my age here, but that was the main thing I learned, and I will never forget. That was exploding the trees, how to get to that pearl of an article that you provide to a physician at the time of need. He can be in a clinic, and we used to do that all the time. I would get a phone call from the doctor. I am seeing a patient in 1 hour. I need this information delivered to me right away so I can prepare. We were not, we didn't have a surgery, so we were not an acute care hospital. But our threshold for answering the questions was no less than what it would be in an acute care hospital. We had a threshold of, if it was a patient care, urgent, we called it urgent patient care. The articles, the search had to be done within 2 hours. And for research questions, it would be first come, first based. But the thing is, we still provided everything within 24 hours. And that's how we established our reputation. And I also presented with the doctors at their conferences, not just at the library conferences, because that's what gained the respect of the physicians. When you team with them, you work on projects with them, they respect you a lot. Shantanu knows, he actually asked me at the last meeting, what is a clinical librarianship? I actually used to work only 4 hours at that time, but I decided to do it outside my paid time, and I would go to the morning rounds with the physicians. I would write down each and every question that they needed an answer, come back to my office within 2 hours, and I didn't have anyone. I was the only one there working only 16 hours a week. And I would provide those answers to the physicians right away. And then we did a study where 3 physicians I did the rounds with, and the statistician and the research director actually became my partners. And it was a very scientifically done study where we saved money in patient care per, at the time, it was the outpatient, per patient, $700 per day. And that was a monetary gain for the hospital. And then, the outcomes changed in others. So they were like 7 studies that we followed. So these are the things you can do, even in a small library, hospital library or clinic library. And you can prove to them that we add value to the organization. We add value to the patient outcomes. The outcomes can change because you did a search. And that search is very important. And I would tell you today, from my experience, learn the best way to do a search. We are using natural language, we are using keywords. That's not really how you do a search. So, learn the proper way of doing a search as a librarian should be doing. And not everyone likes to search. So, but I loved searching. So, I learned that. And it stayed all my life. And even now at the college, they all ask me when it comes to the medical searches because they are very different, medical and business. Because even though I was in a hospital, I actually started business searches for them. And the hospital was able to get every single day information about their competition, the trends. This was a search that was done on a daily basis. We used to call them alerts. Probably you all, or some of you, are aware of Dialogue. I used to use Dialogue. It was a small hospital where I started with total of $5,000 per year budget. And the first year, it included my salary. There were no journals, nothing. But we reached a point where it became actually one of the top libraries in the nation. So you can all do that. We didn't have a university to support us. When you are in academia, you actually have a library because the students are there. But in a hospital library, we are not fortunate to have that. So we have to prove our value to the hospital administrators. So this is what we did. At that time, I had, and this is now for the consumers, the patients, and the families. So what we did was actually the director of the pediatric program came to me, and she asked me to organize her. She had a room, 12 by 12, which was full of journal articles, brochures, which she used to, and lots of other things, pamphlets, which she used to spend her own money. And she would give all those things to the patients and the family at the time when they came to see her. She was a very devoted doctor. She would lie on the floor to see a patient and play with them. So when she called me, I looked at her, and I'm going to give a brief summary of what we did. So what we did was, when I went over there, I looked at it, and there were some very, very old journals, very old pamphlets. And I made notes of everything. I came back, and then she came to talk to me. We talked for about 2 hours. And she said, Nalini, I need it really organized. The minute the patient comes in, I want to hand it over to them. And I thought about it for two weeks. And then I decided the best way was to provide information digitally and not in paper format. I went back to the team and I suggested that we actually do a digital access to this website. And they were very, very excited. So I said, just send your questions to me and we will start working on it. Within the next 2 weeks, we saw that each day I would get about 30 to 40 emails with the suggestions for websites and how it should be done. Now, I had, at that time, I had three people. So we started working on it, but we realized very quickly we could not keep up with that. And there was no way they were going to hire a person for me. So then I went back to her and I said, we cannot keep up with this. We have to come up with some kind of a plan here. So I decided to apply for grant to the National Library of Medicine. I wrote the proposal myself because we did have a grant writer, but what I figured out was that I had to tell her everything and then she would write. So then I have to check it, and then she would edit it. So I decided I was just going to write it myself. We wrote three different proposals, and four different proposals in 4 years, and we got funding 4 times from the National Library of Medicine, and we developed 2 websites. And those websites were used very, very heavily. They were actually based on a very scientific methodology. It was not like we just decided this is what we want to do. So these were the goals and objectives: develop a better understanding of the health information needs of consumers and patients with physical disabilities and chronic conditions. Provide access to information when and where needed, at the point of care, at the point of need. A single platform for patients with physical disabilities and chronic condition to facilitate the exchange of knowledge, ideas, resource through internet and social media. And that's where you collaborate, you create, and I think, I forgot to write that somehow, but actually I heard, I think it was one of the presenters before me, Shantanu, I think. Shantanu said, collaborate, right?
Yes, connect,
Yeah.
collaboration. Yes.
Right. So that's what we decided, that we needed to come to that platform as a community, and they could ask us questions. We had to answer them. And our pediatric director and the nurses were very good. They would answer the questions. We would actually add continuously every single day. I would have to go to those websites and add things. It was also, there were 60 minutes individual interviews with 7 program directors. 60 to 90 minutes focus sessions were held with each program team consisting of physicians, residents, therapists, clinicians, and then 60 minutes individual interviews with patients. There was a survey which was sent online and print. And this was just one of the, I just wanted to show you one of the slides. But
Nalini, we have around 2 minutes with you.
Okay, so I'm coming to an end. So what I wanted to tell you, Shantanu, is I will add some of these slides I didn't add about the survey, and then we can share it later on. So the results were: consumers need information. Internet is number 1 source. Technology was one of the barriers. Too much information, difficult to sort. Fact checking, which is difficult to get to the original source. It is time consuming, not certain about its reality. So then our website went live after this. So this is the Information Connections website, which is actually for children, parents of children with disability. And then I'm going to quickly go down, because this is all about the website, and it gives you all kinds of information that they need. And then we have the other website, which is Disability and Rehabilitation. Now, I just want to inform you that this is what I did when I was there. And 2 years, they have not touched the website. They would not allow me, even on volunteer basis, to do anything. But now we are actually talking. I'm willing to give them my volunteer time every day to update these websites, and they have agreed to that. So these, will be now updated again. And then at the end, what I want to tell you is that, to sum it up, I strongly believe that having timely access to high quality and reliable information at the point of care and point of need helps clinicians and consumers make informed healthcare decisions. It can reduce hospital costs. It can improve patient outcomes. Our mission was to provide knowledge-based information resources and specialized services to all Marian Joy associates, including physicians, and help users obtain reliable and up-to-date information. So delivering information when and where needed is, again, my really mantra. So if you can do that, keep your promise. That's one thing. You have to keep your promises. I could not just make them a promise and say, well, I'm sorry, but I couldn't do your search. I knew the physicians very well. I knew how they liked their information. The younger physicians wanted them, and we actually delivered them in packages. So it was very custom made packet for them. If they wanted hard copy, we'd provide hard copy. But I also knew how they wanted the information. It was funny that one time someone else searched for them. And actually, the doctor came back to me and she said, Nalini, who did the search for me? And I looked at her and I said, well, we hired someone else because sometimes we have to do that. She knew right away. She said, it was not your search. I want you to do my search. So they become familiar with you. So digital libraries have become the heart of knowledge societies. They enable people to access, share, and apply knowledge. Hospital librarians can play a very important role by integrating the hospital library with patient care, teaching, and research, and by leveraging social media to minimize misinformation. At Marian Joy, we had a community-wide digital inclusion initiative linking libraries and communities, with library staff playing the lead role. Thank you. That's the end. And my last thing, just knowledge is power, information is liberating, education is the premise of progress in every society, in every family. And I want to thank you all for giving me so much time. I do hope that you all enjoyed it.
Thank you, Nalini. Thank you very much. Thanks a zillion tons, and it was absolutely mind blowing, experience for all of us to, share your experience with us, your best practices which you have implemented at Marinjoy Rehabilitation Hospital. It's really highly commendable, and I know why Marinjoy is been ruling so much so because under your leadership, and I'm sure they are into new things. And the and the another classical part is that Nalini, I am flooded with questions for you. So and I know somebody told me when there was a long time when I was interacting with one of the professor of Harvard Business School. And he said when you get number of questions, it means that the people were all attentive and they have understood your thoughts. So that's why they want to raise questions. I think that's a very positive thing to take up. So with your permission, can I take up before I wrap up quickly?
Yes.
Parallelly, and you won't imagine, we had only 100 registrations in the Google and it came down. The numbers didn't came down. Whereas in parallel, there are more than 100 people are already logged in the YouTube link. So next time, I think that's a great experience. We have to expand it more. So I'm just quickly, addressing a couple of questions which are very pertinent has come up. So with your permission, can I start the questions?
Sure.
Okay, so this is a question from my previous colleague. He has said, good morning, madam. It is really unfortunate to know that there is a decline of 30% medical libraries over the last 10 years. When we talk about the knowledge sharing and knowledge management, etc., what are the reasons of the decline in number of libraries? Your comment, please.
As I mentioned, what's happening is, for example, the hospitals are actually joining forces. So they are under the same system. So in other words, there may be 10 hospitals. They join and become one system. So those 10 librarians, if they were, 10 librarians, one for each hospital, now what they are doing is they are going to basically lay off those people. And then those librarians who are there, they will actually go from one place to other, and many of them are doing it. So
Yes.
they might go to 3 hospitals and cover that. So that is one of the big reasons. The other thing is, I will be very honest, we as librarians are not business savvy. We do not treat library as a business. We look at it from the educational point of view. So we
Sure.
do not know how to promote it, how to brand it, how to earn the respect. Because I think, Shantanu, you should do one, it's a suggestion, on ROI,
Yes.
return on investment.
Yes, I know.
That, I presented that at 4 or 5 places, and I have a colleague who also specializes in that. We both
Yep.
presented.
So I
And
think you can get me
something
connected
very-
to him. Probably we can think of something like that.
Yeah.
Certainly. Okay.
But I think that's very important to do.
Yes,
with
I can
that.
understand. Nalini, I'm taking the second one question. This is from Mr. Jahangir Khan. What type of digital technology in your institute in healthcare information services was implemented?
So the technologies that I talked to about, which was like, the biggest thing was actually the records, the health records.
Yeah.
And they are now with, I don't know, Northwestern has, I don't know how many, maybe 50, 60 hospitals now. So every single hospital is connected. In the
Okay.
library, all our databases are connected. So now we have access to all these databases. We do pay individually each hospital, but they are together.
So they are
all the
integrated.
databases, yes, in the library, all the databases are together.
Yes.
Also, I will call it a digital technology. In the hospital, when I was there, we had a space on the server where we would put the articles. They could come and access those articles right away. We would send them, we would print hard copies, but the younger generation didn't mind going to the server and getting those articles.
Yep.
And then, the other virtual reality, they are doing all that, making appointments with the physicians. That's all being done. So almost all the technologies, except the ones that I talked at the end, the smart hospitals and all that, that's not there.
Yeah.
But otherwise, all the technology that I mentioned, that's being used.
Nalini, I think there are a lot of questions have come up. I don't know. I have a shortage of time because I have to close it down. So I'm sorry, I won't be able to take all the questions, but there are a couple of questions which I find that's very important for you to answer. Like, for example, you talked about patient database. I mean, if you can, if you are okay in giving the answer in brief or few words or lines or something like that, because of the paucity of time, like Dr. R.N. Mohanta has asked from patient database for each patient will be the key for treating the patient. How India can handle with creating and managing the database, also can provide how can patient choose the right doctor for treatment, how AI will help. Well, the technology. Yes, hello.
What I talked about was the electronic health record. So that's
Yes.
So that is how you are going to connect. And so then that electronic record per patient, where you are, if say AIIMS has a collaboration with another hospital, then that hospital can also access that. But not only that, first think of AIIMS. I don't know, do you have that electronic health record?
Yeah, we have EHR.
Okay.
So yeah, we have.
Okay. And the other thing we do with that is also the databases are linked to that. So when the patient comes, and if the doctor wants, when he goes into the health records, if he wants to do a quick search himself, he can do a quick search himself.
Yeah. Okay.
And get the information.
Yeah. So I am extremely sorry. I have flooded with questions, so I can't take it more because I have to close it down because this particular studio is booked for the
Oh,
next sessions. So I have to vacate it.
oh, okay.
Before, thank you once again very much, Nalini, for accepting our invitations to be a part of it. I would request Mr. Prashant Srivastav to please propose a vote of thanks for this particular webinar.
Yes, sir. I before presenting the vote of thanks, I will present a short slide.
Well, while he's connecting this slide, I just want to thank all of you, every single one of you who attended this session. And I would love, actually, Shantanu, I would love to have a feedback from people as to
Yes.
what I missed and if there were any things.
Yeah. So basically, I am requesting everybody is asking for a feedback form. Sorry, we do not have such kind of a feedback form system and all. But what I would suggest that if you have any questions or feedback or whatever it is, please you have our email. So please send it across
Yes.
to us. We will forward it to Nalini. We'll get you connected to Professor Nalini on this.
Yeah, that would be great.
Yeah.
Because any
So Prashant,
questions, I will be
Yes, sir.
glad to answer
yeah,
any
Prashant is
questions.
all yours.
Yes, yes, sir. Thank you, Dr. Ganguly and Dr. Professor Nalini, to present a very informative and wonderful presentation and discussion. Sir, my slide is visible, sir.
Yes, yes, yes,
Yes.
Prashant. Please
Yes,
carry
sir.
on.
As per the topic of today's webinar, this is the in brief that the patient care is in the nucleus and healthcare communities prepared and do their efforts in the light of the medical library resources. There are various medical library resources; those are provided by the medical library to their readers communities. Those are the medical knowledge discovery services of the searches and on point of care tools. Now, in this pandemic time, it's a very critical to manage these services. Now, this digital health connect can provide us a opportunity to how we can proficiently do those services. I want to inform you that we have set up a quiz before this webinar, and the questions are: what may be the prominent roles of the libraries to play during the COVID-19 pandemic? What may be mode of the library suitable and for the this pandemic time? What are video journals and COVID-related infodemic just as dangerous as the virus itself? And do you interested to discover new possibilities for digital life in pandemic time? And we are very glad to inform you that we have very good responses around now. It is after this beautiful presentation and discussion, we have received more than 300 responses. Now these are the results that most of the responses are on the favor that these are the available library service support to the our healthcare professionals to provide awareness on the preventive measures relating to COVID-19, to provide document delivery services during lockdown, to support research working on COVID-19. And next one is the what type of the library mode is suitable at this pandemic time. That is the hybrid interactive mode, and it is favored by most of the responses. And one of the relevant question related to the resources, that is most favored resources in the domain of the medical librarianship, that is the video journals. And it is a visible journal and presented by the researchers and medical practitioners. And one of the good of the WHO is the COVID-19 related pandemic is just as dangerous as the virus itself. It was selected by in most of the responses. And of course, this is one of the choice of our participants to select this particular webinar to find out more possibility of digital libraries. Finally, I will present my vote of thanks. Good morning again, everyone. This was a very interesting presentation and discussion on the theme of the conference, which will definitely enlighten good professional efficiency and digital approach to the LIS professionals and users and our and our medical communities. Those are benefited by the medical library services. Now, first, I would like to thank Director AIIMS and Professor in charge AIIMS Library to support us at all stages of this webinar. My heartfelt thanks goes out to the Professor Nelly Mahajan to discuss wonderful presentation on the relevant topic at this pandemic time and provide good inspiration to medical librarian and librarians. My heartfelt thanks goes out to the Dr. Chandanu Ganguly to initiate and make Digital Health Connect webinar series a reality. We have been very much impressed and in touch with the aptitude of the participant for providing interesting quiz responses for their precious time. We are very thankful to AIIMS Computer Facility and CMET Department for reliable technical support. I am very much thankful to BBDL team and especially to Mr. Deepak for their wonderful support. I hope we will connect soon with another relevant topic of Digital Health Connect webinar. Till then, goodbye and have a good day. Thank you.
Thank you, everybody. Thank you very much. And on the behalf of All India Institute of Medical Sciences, I once again thank the everybody. Professor Nalini, please take care of yourself. Don't get
Yes,
fainted
ma'am.
once again. You really give me a lot of shock. Don't
Yes,
do
yes.
that. Please take care of your health. And
I
good
will.
to connect with all my beloved, professional friends who are here. I'm seeing them after a long, long time. And I'm sure we are all going to gain a lot. In fact, in coming
Yes.
webinars, we are going to have many more speakers. In fact, I'm already connected with many of the speakers. I'm just taking their time when they can give their time so that we can have. We are planning to have speakers from South Africa this time. We are planning to have speakers from, Nepal, our neighboring country, from Sri Lanka, from Bangladesh, from Indonesia, South Asian countries. And I'm also going to bring out some of the speakers from the who are basically working on the different sectors of sustainable development goals, on SDG goals, and with special emphasis to, healthcare sector, how information is playing a very vital role and all. And I'm also trying to get in touch with the information head of WHO also, if he can also come and give us a discussion with us. So thank you very much once again. Thank you,
Thank you.
Mr. Khan, Chandra, Rakesh, and I can see Umesh here, Deepak. I think my team has done an amazing work behind this. Behind this, thank you everyone. Thank you, Mr. Khan, and everybody. Thanks, Prashant, for
Thank you,
bringing
sir.
in Niku and all everybody. Thank you very much, and see you and take care of yourself. Please be there. Thank you.
Thank you, sir.
And as many of you are asking about the feedback, let me tell you, if you have a question or a feedback, please write it to me because you must have received an email either from me or from Mr. Deepak. Please write it to that, whatever the comments and suggestions. And I know we have done many mistakes and we'll always learn from mistakes. Without mistake, there is nothing called as a Kaizen called
Yes.
continuous improvement. So I always believe in Kaizen. So Kaizen can only comes when you do the mistakes. So please send your feedback to us and I can make an improvement in the next ones. Thank you very much and stay connected, stay safe and stay healthy. Thank you very much.
Thank
Once
Thank
again,
you, sir.
bye.
Thank you.
Bye.
Bye.
Bye. Bye everybody.